If you've had a stroke or a head injury, or perhaps after brain surgery you're struggling with the wilder movements more than paralysis that doctors and physios will tell you is ataxia. I've met an awful lot of physios who are lost when it comes to treating ataxia. And it is difficult, but there are some simple things that can be done, straightforward things that can be done to really help. I can tell you a little bit about this, and the first thing I can tell you is this isn't meant to be medical advice on its own. These are tips and ideas that you can reintroduce and talk to your own physiotherapist about when it comes to exercising to deal with ataxia. These are tips and ideas that will be good to discuss with your own physiotherapist about dealing with ataxia. So I've almost got a little checklist to go through with you. One of the biggest difficulties after ataxia is, in fact, the way that our body tries to deal with it. Nobody likes falling over. So when you've got ataxia, and it's fairly severe, one of the things that your body will do is try to make your trunk more stable. So what I mean by that is ordinarily a person might sit up and free from the back of the chair. But what somebody with ataxia will invariably do in order to do it is actually drop into a slight slump and then correct their head into what you might maybe unkindly call, but not intentionally so, describe as a poking chin position. So somebody with severe ataxia will often sit in a slumped position like so, chin up, chest down. And then what happens is that over time they get really stiff there. And actually very few of us, and I mean healthy, vigorous, active people, very few of us really use what you can call the extension range of flexibility in our spines. We all use flexing, bending to work, bending looking at screens, sitting in armchairs, in theatre seats, in car driving seats or passenger seats. We're all using those flexing positions. People who work as landscape gardeners, brain surgeons, almost all of us are using flex in our spine and very little in the way of extend. If you paint ceilings for a living, then you're one of the few. Very few of us use the range of movement in our spines that we would call extension, which you can call, you could also call bending backwards. Kids do this lying on their tummy, reading books on the floor, spontaneously. And that's one of the few times that you'll see people do it who aren't doing something unusual, like painting ceilings or being a gymnast or extraordinary things like that. One of the main things to deal with after stroke or other brain injury or illness producing ataxia is to get back the extension range in your spine. And here's the thing, is that one of the best exercises that will do that is in yoga called the cobra position. Which is to say, lying on your tummy, almost in a press-up position with the top half of your body but with your hips and legs still lying flat, facing downward. Or can get help from somebody to help you lie on a bed and then get face down, then that's a great start. Now, a lot of people don't like being face down. For some, it's been a long time since they were face down. So don't be shy of going for something a little less pure to start with. So maybe it's turned quite a bit to one side. Maybe it uses a cushion or a pillow under the chest to help, so that the face doesn't feel too claustrophobic. So don't be shy of adapting it. It's not likely that every exercise that you attempt is going to be perfect first time. If it was, we just wouldn't be talking. So don't be shy of adapting. Don't be shy of using a so-called lesser version of the same thing in order to get started. The biggest problem is expectations set too high so that people fear seeming like they're not performing, not trying, aren't up to it, letting people down. All of those sorts of thoughts and ideas that can go through people's minds when they're struggling. Face down, using the hands to push up part way, resting on elbows, maybe going as far as straight arm. This then is extending the spine. It becomes very powerful when you do the yoga version that I describe, which is often called Cobra, and involves strong breath in, best through the nose if possible, and exhale. Inhale. On the way up, exhale. On the way down. Once you've begun to master a little bit of extension in the spine, then beginning to add other movements to it. And reaching through and twisting underneath to add twist and extension to my movements. These exercises will almost certainly be good to add to any program to help with ataxia. Of course, you have to be careful of not working through pain, and there may be other restrictions on your doing this kind of exercise. That's why it's important that you don't treat this video as pure medical advice, but that you use it in conjunction with help and advice with the regular physical therapist or physiotherapist with whom you normally work. If you do have a physical therapist that you're working with, and other flexibility work, particularly dealing with the main spinal joints within your chest, the thoracic spine or dorsal spine in old money, of course that's good. Low back or lumbar spine flexibility really goes with it. And if possible, inhale up into all fours and beginning to sit back on the heels. Now that might be difficult. There may be knee problems. Some folks may have had a knee replacement. And if you can't go all the way back, well, that's maybe less than ideal, but you can still perhaps have a go. You might need somebody to help lift you to get back, because this is quite a strenuous movement. So in full, the combination that I mentioned, which is Cobra and Sun Worshipper, is pushing up into extension, either full or half. And inhale. As you sit back, exhale. So with the tape, I've done it at full speed. It may take you longer. You might have to do 2 or 3 breaths for each cycle, particularly the sitting back part. It's difficult, it's strenuous, it may be challenging, might be a long time since you've done anything like it. Adaptation. If it takes more than 1 breath to do each movement, that's just fine at first. All we can do is recognize it's a challenge and then try to refine. And so does hip mobility, hip flexibility. That can also drive the problems with posture, particularly if somebody's been sitting for a long time. How do we know if they've got problems with their hip flexibility? If somebody's got problems with their hip flexibility, when they try to grab one knee and pull it to the chest, what happens is that the other knee comes up like so, automatically. And even an old fella like me should still be flexible enough that the one leg stays flat to the bed when I hug a knee up to my chest. And with a bit of luck, both of mine will do it. What doesn't happen is that, which indicates that there's not enough flexibility in the main hip joint. So that's also an important one to look out for. That will cause too much stooping when somebody tries to stand. And you can do it to full extension of the arms, but mostly you only need to do it up as far as the elbows. But the important thing that yoga introduces into this type of exercise, that if you're a physiotherapist and watching that, you might be thinking, ooh, Mackenzie's exercises for bad backs. Yes, one of the things I never heard Robin Mackenzie talk about when it comes to doing extension work in the spine is to also do breath control work. In our center section, we have the spinal column, which is bony at the back. Ribs come down quite far. The front wall of this box is pretty much all muscle and gristle. Then underneath, you've got the big scoops of pelvis. Underneath, you've got the big scoops of the pelvis with a big hole in the bottom, which is covered by muscle and gristle. And that's what ladies will be more familiar with as their pelvic floor. And then most physical therapy or physiotherapy that I've seen leaves out the pelvic roof, which is to say the massive muscle that is your diaphragm. And your diaphragm does a few different things. And one of them is breathing. That's what it's most famous for. But it also does a range of other things. It's one of the main parts of the pump that supplies your heart with blood. It literally sucks blood up your leg veins to deliver it back to the heart. The heart won't pump if it doesn't have blood supplied to it. It's quite a reactive organ in that way. So the diaphragm is incredibly important muscle and rarely treated after stroke. But you must regain breath control. And that's to say, when you breathe in, as you breathe in, the film will show that my hand went forward. In other words, my stomach started to bulge. And that's because my diaphragm squashes down and just pushes the contents of my tummy and the front wall out away from my body. So my stomach area swells with the breath in. Now, combining that action with spinal exercises, pushing up into cobra if you can, or half cobra, which is to say propped up on the elbows, then coming up into all fours and sitting back on the heels, which might be called sun worshipper. They're quite difficult exercises to do, so if you're very ataxic, you might need some help doing them. They are difficult, so they might need to be done on the floor. Maybe you can't get on the floor. If you're doing them on a bed, I would always recommend that it's a double bed and you start in the middle, because some people are that wobbly. Of course, you have to maintain safety. Falling over is just not a good option, obviously.